you so much, Dr. Umeh, for sitting for this interview. I'm really excited to talk to you. If you could just start by giving an introduction, your name, your job title, and the organization that you work with.
Okay, my name is Dr. Charles Umeh, and I am the Executive Director of Parkhurst Mobile Clinic.
Okay, great. And what is your connection to contraception or reproductive health?
Okay, so what we do at Parkhurst Mobile Clinic is that we strengthen healthcare services delivery for vulnerable population in southern Nigeria. So what we basically do is that we partner with international organizations and also with the government to implement specific healthcare interventions. So the focus of most of our healthcare interventions is basically on primary healthcare, on maternal and child healthcare. Then the main aspect of maternal healthcare that we focus on is on family planning, because we have come to realize over the years that family planning is one of the strongest tools for reducing child morbidity and mortality. Then we also, based on our research, we discovered that family planning is also one of the strongest tools in reducing maternal mortality too. So the focus of our organization have always been on family planning, maternal health, nutrition, and primary healthcare services. So over 40% of what we do as an organization is on family planning and maternal healthcare.
Amazing. That is so great to hear. How long have you been in this field?
Okay, I had been working in the field of primary healthcare and family planning for 6 years now. Yes, 6 years.
Okay, and I know you mentioned reducing maternal and child morbidity, mortality. Do you have any personal motivations other than that for working in the field?
For me, I grew up in a setting here in Nigeria where I noticed quite a lot of children and mothers die prematurely due to what I can describe as lack of attention. For me, the main reason of this lack of attention is basically due to the fact that the mothers and the parents did not plan well for their children. So they found themselves within some instances where they find it difficult to care for the children that they have due to that fact that they do not actually plan well, okay, when they were designing their family. So I picked up that interest in healthcare as a whole and also on family planning. And so this is summarily my motivation. I had a childhood experience where I noticed children, mothers die prematurely due to lack of care. And this care, I believe, would have been there if the mothers actually planned well for their children.
Thank you so much for sharing that. What do you think are the biggest challenges that you see in the clinic affecting contraception?
Based on my experience, I believe so much that the contraception materials, that is the family planning drugs, basically the condoms, the implant, the injectables, the pills. I mean, those contraception materials, I actually believe that they are there, okay? One of the main challenges to family planning and contraception is that people are not willing to accept family planning, all right? This non-acceptance is basically due to cultural disease, due to myths, disbeliefs, and also due to fear of side effects from the family planning. Yes, these are the main barriers that I see that affect the uptake of family planning.
Okay, thank you for sharing that. Have you seen these challenges evolve over time, or have these challenges kind of always existed?
From my experience working in different aspects of family planning, from advocacy to service delivery to monitoring and evaluation and also research, I think that these challenges have actually evolved, though they have evolved positively to some extent, but not enough to be a success in terms of access to family planning. Because from the time that I started working in the field of family planning till now, I can say that there have actually been some kind of positive change in attitude of people towards family planning. And I can say categorically that this positive change can actually be ascribed to the fact that, okay, people are beginning to see more reasons to adopt family planning based on the economic challenges that most people are having in different parts of the world. They have seen that reason to actually plan well for the number of children that they want to have so that they can be able to better care for their children and give them attention. So I can say that there have actually been this positive change in people's attitudes to family planning.
That is a really great positive change to hear, that attitudes are changing and evolving. Have you seen that either women that come into the clinic are interested in involving their male partners, or are you seeing men interested in contraception at all?
Here in Nigeria, and also in most African countries, there's this male dominance in families, even though this is something that is changing a bit. But most women, before they can access family planning, they always want to discuss with their husband, all right? So that they can be able to agree together before the women can access family planning. So from what we notice, the uptake of family planning most times is dependent on the man's ability to accept that, okay, family planning have to be done. So I actually believe that men's engagement in issues of family planning is actually very important because most times it's actually them that decide on whether a woman adopt family planning or not.
Okay, that's very interesting. I didn't know that. What are some of your hopes for male involvement in family planning, as far as like male contraception?
Okay, so first, I have this special interest in male contraception because I believe that the only way for us to achieve gender equality in family planning access is for men to be involved in family planning. And unfortunately, the only method of family planning we have for men is condom and vasectomy. And these two methods have their own challenges. The use of condom reduces sexual pressure for the men and also for the woman. So most couples are not comfortable using condom. Then the other method of family planning for men, which is the surgical method, that is the vasectomy, it also has its own challenges because most men are not comfortable with undergoing something they think is surgery just for the sake of family planning, even though we know that vasectomy is a minor surgical procedure, but most men don't seem to be comfortable accessing vasectomy just because they want to do family planning.
Yeah, I completely agree. I think you really hit the challenges on the head, as far as what the barriers are to keep men and women from involving men in family planning. What do you think that we can do to overcome these challenges to better include men in family planning?
I did a master's degree in surgical sciences in the UK. And the research that I did was on vasectomy as a family planning tool. The purpose of the research was to understand the attitude of men towards vasectomy, and also to know why they don't want to do vasectomy, and to also know what can be done to make sure that they accept vasectomy. Then as part of that research, we try to ask men if they would be comfortable adopting other family planning method, okay, which is not invasive and also which does not interfere with their sexual intercourse. And most of the men agreed. All right. So I think that one of the best things that can be done to increase men's engagement and adoption of family planning is to develop methods of contraception that is easy for men to take. Okay. I am aware that some organizations have been working over the past few years to develop some method in terms of some injectables, some implants, and other methods that men can potentially use as a contraception, which is non-surgical. Okay, I believe that these methods, this new research for development of new male contraception method actually have that potential to increase the engagement of men in issues of family planning, and it also has that potential to ensure that men and women actually have that equality in access to family planning.
Thank you so much for your explanation. And I'll just say that I agree. I think that providing men and couples with more contraceptive methods is the way to get them more involved. It was so interesting to hear your experience with men, asking them and hearing that they are actually interested in participating more in family planning. So thank you. Just as a last kind of wrapping up question, is there anything else that you would like to share with us in this interview?
I wanted to mention that I'm hopeful that over time that the research that is currently happening on the development of male contraception alternatives can actually be successful over the years. I know of organizations like Contraline and other organizations that are actually doing some active work so that they can be able to develop some male contraception method that can easily be accepted by men. So I strongly believe that this research will be successful within the coming years. And I also believe that when this new method actually exists in the market, that it will actually give room for men to be more active in family planning. Thank you.
Thank you so much, Dr. Umeh. I very much enjoyed hearing your perspective, and I agree. I hope that we will see more male methods come into the market soon. So thank you so much.